Welcome back to MedEd Market, the ultimate resource hub. Today we're covering high yield concepts with regarding to biostats. This is highly relevant for USMLE Step 1, 2, and 3, and this is going to be the first video in the biostats video series. So today we're talking about incidence versus prevalence, one of the most foundational concepts in the biostats section. When it comes to incidence, the question you will get asked or should think about is how many new people have developed a specific disease. The definition of incidence is the number of new cases of a disease that occur in a population during a specified time period. Whereas prevalence, the question we want to ask is how many people have developed the disease right now. So this is the total number of existing cases of a disease in a population at a specific point in time over a defined period. So when I think of incidence, I think of N incidence for new cases in the population that have the disease, and prevalence, I think of Prev all ends. This is all existing cases in the population. So we're going to use the faucet and sink analogy to try and better understand this concept and make it super clear. So think of the water in the sink, everything that is in the sink here, and the drain is plugged. That means we're holding on to this water. This is our prevalence. This is all of the existing cases. Let's say all of the people in the population right now with diabetes are represented by the amount of water in the sink. And then water that comes from the faucet, so if it starts trickling down, this is going to be the new cases that become diagnosed and enter the population. So let's look at case 1. In this situation, our faucet is off and our drain is plugged. So this shows us that the water in the sink is staying the same. The water level stays the same. That means this is our prevalence level. It's stable, it's high because the sink is pretty much full. We have nothing coming out of the faucet, which means incidence is 0 because no new water is entering and therefore we have no new cases. So this is a situation of 0 incidence and a stable prevalence level. Now in case 2, we have the faucet on, so new water is now entering the sink and our drain is still plugged. So what happens is new water is entering, and as it's entering, our water level in the sink is also rising. So that means new cases are occurring. That means incidence is increasing. And because new cases are being added into the population of total existing cases, that means our prevalence is also rising. So we have high incidence, high prevalence. And the third case we're going to look at is we have the faucet off or low, barely running. So we're going to say 0 to little new cases. And all of a sudden our drain opens up at the bottom and water starts seeping out. And that drain opening represents the disease either being cured or patients dying from the disease. And what that means is that our total number of cases are decreasing because either A, patients are being cured through a brand new treatment that is completely curing the disease and leading to patient recovery, or 2, patients are simply dying from the disease and therefore they are leaving the population. So in this situation, we have faucet off or barely running, therefore new cases are 0 to very few, and prevalence is now decreasing because people are either being cured or they are dying and our drain is open. That means prevalence is going down. So now that we looked at these 3 cases, I want you to think about the overall concept of how would you decrease the incidence? How would you basically stop this faucet from running and new cases entering into the population? And the main way to do that is to basically prevent disease from happening in the first place. That's why we have primary care physicians and practitioners that are trying to focus on primary prevention. We want to prevent disease from happening by mitigating risk factors and maybe giving statins to prevent a heart attack and just overall trying to prevent disease from happening in the first place. Now, on the other hand, how would you increase prevalence? How would you increase the water level here in the sink? Two main ways. That is one, to increase the incidence. So we'll turn on the faucet, that'll start running, and more new cases would run into the sink. And the other way is to have longer survival. So as more new cases get diagnosed over a long period of time, if this is, for example, prostate cancer, where patients might have really long survival despite being diagnosed with prostate cancer, then that will increase our prevalence over the next 10, 20 years as more and more people have prostate cancer but aren't dying from it because it is not known to be a rapid and aggressive cancer. Now, on the other hand, how would we decrease the prevalence in the population? How are we going to lower the level of the water in the sink? And as we looked at the drain case, we can either develop a cure, right? Make sure that we develop a treatment that completely cures patients and they recover and they are no longer diseased, or we can increase the death rate. As more people die from that particular disease or cancer, they are leaving the population. Therefore, the prevalence, the number of diseased people, decreases. All right, so that's our core concept there. I hope you are going to keep watching with me here as we go into a couple of practice questions. So question number 1, a chronic disease affects 10% of the population. A new medication is introduced that dramatically prolongs survival but does not cure the disease. What will most likely happen to the disease prevalence? I'll give you a couple seconds to reflect on this. Pause if you need to. Our answer here is that the prevalence is going to increase. Now, why does it increase? It increases because we're not curing the disease. All this new medication is doing is it prolongs survival. But those patients that are living longer and longer still are in the disease state. Therefore, prevalence is increasing. So better treatment often increases prevalence because patients live longer with the disease. Now, if we said this medication completely cured people of the disease, then that would actually lower our prevalence. So make sure you're paying attention to whether it prolongs survival or cures disease. Question number 2. A researcher notes that two diseases have identical incidence rates. Disease A lasts approximately 20 years. Disease B lasts approximately 2 weeks. Which disease will likely have the higher prevalence? Give you a few moments. The answer here is disease A. So if they have the same incidence, it means that the number of new cases appearing is the exact same. But what changes is the duration. So if we're looking at the total number of cases over 20 years, that means that we're going to have significantly more diseased patients or people over that 20-year period in total that exists over that entire time compared to just over 2 weeks. Remember, prevalence is the total number of existing cases over a defined period of time. So obviously we're going to have way more cases of diseased patients over 20 years compared to 2 weeks if our incidence or total new cases is the exact same. Question number 3. A disease has a high incidence but low prevalence. Which characteristic best explains this finding? Our answer here is C, and that is rapid recovery or death. Remember, high incidence means many new cases, but at the same time, we have low prevalence, few total existing cases. And the reason this happens is because disease duration is short. That means either we are very quickly curing people, therefore the total number of disease cases is going down, or those cases are dying very quickly, therefore the total number of disease patients in the population is going down because they no longer exist because they have passed away. Question number 4. A physician begins screening aggressively for a previously underdiagnosed disease. Which is most likely observed immediately after implementation? Our answer here is B, incidence increases. Now, this means that we are screening more patients and more patients are being diagnosed when before we had maybe a poor test that wasn't screening them properly and diagnosing patients properly. So more cases are being detected. Therefore, the total number of new cases or the incidence is rising and increasing. So just because we come up with a better screening test, that is going to increase our incidence. On the USMLE Step 1, 2, and 3, you will almost always be expected to do some sort of math. So let's look at one that's mathematically involved. Question 5, a disease registry identifies 400 patients currently living with multiple sclerosis in a town of 20,000 people. What is the prevalence? Our prevalence here is 2% because remember, prevalence is the total number of cases. So in this situation, it's 400 patients with MS over the total population. So that gives us 0.02 times 100%. That is 2% prevalence. In our final question, number 6, a disease becomes curable after introduction of a highly effective treatment. Assuming incidence remains unchanged, what happens to the prevalence? And in this situation, the prevalence decreases. We talked about this concept earlier. This medication is now curing the disease. This is a treatment that is leading to recovery of the patient, so they are no longer in disease status. So the cure shortens the disease duration, and therefore the duration decreases and the prevalence decreases. So remember, this is our key concept, understanding incidence versus prevalence. Incidence is new cases, prevalence is all existing cases. And just a quick high yield prevalence equals incidence times duration. So if we have higher incidence or a longer duration of the disease, we are going to be increasing prevalence. And if we have a shorter duration of disease or more people leaving, for example, because they are recovering or dying, that is going to lead to a lower prevalence. Thanks so much for tuning in. If you found this video helpful, don't forget to give it a like and make sure to subscribe so you can tune into the next videos in the Biostat series. And we'll see you in the next one.